Hello everyone and welcome. Today, we're diving deep into a fascinating yet often overlooked disease, ureteral schistosomiasis. This parasitic infection, primarily affecting the urinary tract, can lead to significant health complications if left untreated. Join us as we explore its causes, effects, and what can be done about it. Ureteral schistosomiasis is caused by parasitic worms called schistosomes, specifically Schistosoma hematobium. These worms live in freshwater snails during part of their life cycle. Human infection occurs when people come into contact with water contaminated with these larval forms of the parasite, known as cercaria. These cercaria can penetrate the skin, entering the bloodstream and eventually making their way to the blood vessels surrounding the bladder and ureters. Once inside the body, the Schistosoma hematobium worms mature and begin to lay eggs. A significant portion of these eggs get trapped within the tissues of the bladder and ureters. These trapped eggs trigger a chronic inflammatory response. The body attempts to wall off the eggs, leading to the formation of granulomas, which are clusters of immune cells. Over time, these granulomas can cause thickening and scarring of the ureteral walls. This scarring can obstruct the flow of urine, leading to hydroureter, which is the swelling of the ureter with urine, and hydronephrosis, swelling of the kidney, ultimately compromising kidney function. Schistosomiasis in general is endemic to many tropical and subtropical regions, particularly in Africa, the Middle East, and parts of South America. Ureteral schistosomiasis specifically mirrors this distribution, being prevalent in areas where Schistosoma hematobium is found in freshwater sources. Factors contributing to the spread include poor sanitation, lack of access to clean water, and agricultural practices that involve frequent contact with contaminated water. Children are particularly vulnerable due to their higher likelihood of playing and bathing in these waters. The symptoms of ureteral schistosomiasis can vary depending on the severity of the infection. One of the most common signs is hematuria, or blood in the urine. This can be microscopic or visible. Other symptoms may include frequent urination, painful urination, lower abdominal pain, and flank pain, which is pain in the side of the body between the ribs and hip. In more advanced cases, when kidney function is affected, patients may experience symptoms related to kidney failure, such as fatigue, swelling, and high blood pressure. It's important to note that some individuals may have the infection without experiencing any noticeable symptoms, especially in the early stages. Diagnosing ureteral schistosomiasis typically involves a combination of methods. A urine sample is often examined under a microscope to look for the characteristic eggs of Schistosoma hematobium. However, egg detection can be unreliable, especially in cases of low-intensity infection. Blood tests can detect antibodies against the schistosome parasite, indicating past or current infection. Imaging techniques, such as ultrasound, X-rays, or CT scans, can be used to assess the condition of the ureters and kidneys, identifying any signs of hydroureter, hydronephrosis, or other structural abnormalities. Cystoscopy, where a small camera is inserted into the bladder, can also be used to directly visualize the bladder lining and potentially identify granulomas or other lesions. While ureteral schistosomiasis doesn't have distinct classifications or types in the same way some other diseases do, the severity of the condition is often staged based on the degree of ureteral involvement, kidney damage, and the presence of complications. For instance, early-stage disease might only show mild inflammation, while advanced disease can involve severe hydronephrosis and significant kidney impairment. The staging helps guide treatment decisions and predict the prognosis. The primary treatment for ureteral schistosomiasis is the medication praziquantel. This drug is highly effective in killing the adult schistosome worms. The standard dosage is typically administered as a single dose, or sometimes as 2 doses a day depending on the local guidelines. In cases where there is significant ureteral obstruction or hydronephrosis, surgical intervention may be necessary to relieve the blockage and restore proper urine flow. Supportive care may also be needed to manage symptoms such as pain and urinary tract infections. Follow-up examinations are crucial to ensure the infection has been eradicated and to monitor for any long-term complications. Preventing ureteral schistosomiasis primarily involves interrupting the parasite's life cycle. This includes improving sanitation and providing access to clean water to reduce the exposure to contaminated water sources. Educating communities about the disease and its transmission is also essential. Control measures can include snail control in freshwater habitats to reduce the snail population that harbors the parasite. Mass drug administration of praziquantel to at-risk populations can also be an effective strategy for reducing the burden of the disease. The prognosis for ureteral schistosomiasis is generally good with early diagnosis and treatment. Praziquantel is highly effective in eliminating the parasites, and any structural damage to the ureters and kidneys may be reversible in the early stages. However, if the infection is left untreated for a prolonged period, the resulting scarring and kidney damage can be permanent, potentially leading to chronic kidney disease and even kidney failure. Recent research focuses on developing more sensitive diagnostic tests for early detection of the infection, as well as exploring new drug targets and potential vaccine candidates to further combat schistosomiasis.